I'm Dr. Sandra Swain. I'm the Associate Dean for Research Development at Georgetown University, and I've really been interested most recently in precision medicine. As a medical oncologist, I've been working with it for years. In fact, at MedStar Health, we have a big program looking at the genetics of tumors and how that can help us treat patients. So when I took this current position, I was really excited about doing something more system-wide for the whole program in MedStar Health. And what came to mind was looking at drug-gene interactions, and that's called pharmacogenetics. So it seemed to be the most likely actionable program that we could work with that would really help patients immediately.
My name is Max Smith. I am the clinical pharmacogenomics specialist here at MedStar Health. And I'm originally a pharmacist, but I have several years of postgraduate training specifically in pharmacogenetics, and that's really where my passion is in medicine, to help apply genetics to pharmacological care.
Pharmacogenetics is a part of precision medicine, and we really chose to go in that direction and working with pharmacogenetics as a program because it's very actionable. That is, patients are on many medications, and patients have many gene variants that can affect the way these medications work. So we really felt that it was the most likely to achieve a benefit for the patients.
Yeah, so something that we're starting to hear from a lot of our clinicians really on the front lines of clinical care is they're having patients come in and start asking them about pharmacogenomics or about genetic tests that they get through commercial companies that they see on TV like 23andMe and Ancestry.com. And so really we're hoping to fill that void of where the clinician gets this question and they don't really have someone to turn to help them figure out what to do. And so we're really here to try and make sure that genetics is being applied to medicine in an evidence-based fashion. And furthermore, the evidence is there to support the implementation of certain genes and drugs and apply that to care today. So it's not something that's far off in the future. You can do this now.
There's a lot of concerns on physicians' part that they don't know what pharmacogenetics is, and there's published data on that. But we are working really hard with Cytel to develop education modules for the providers, and these will actually even get CME credits and CE credits for the pharmacists and the nurses. So we're working very hard on the educational aspect of this program.
Pharmacogenomics can really be applied by both specialists and generalists alike. You know, you can have the example of a specialist. Let's say a cardiologist is just admitted a patient. They underwent percutaneous coronary intervention, and they're tasked with deciding what antiplatelet agent to put the patient on. So you can use CYP2C19 genotyping to guide that decision. And on the flip side, you can have a general clinician, like a typical primary care practitioner, facing, for example, chronic pain. Chronic pain is responsible for a large proportion of visits in the primary care setting, and one of the first options a lot of clinicians turn to is tramadol. So we know that tramadol is metabolized by CYP2D6, and furthermore, we know CYP2D6 has polymorphisms in the gene. So we can actually see different versions of the enzyme based on the genetic codes. On one hand, you can have a patient that is an ultra-rapid metabolizer, where this enzyme is really working overtime. It is metabolizing drugs really, really quickly. And in the case of tramadol, which is a prodrug, that means you're going to have higher levels of active metabolite and therefore a risk of adverse events. On the flip side, if you have a poor metabolizer, you can have an enzyme that really just doesn't really work very well, if at all. And so therefore, you're not turning the drug on to that active metabolite, and you wouldn't really see the benefit you would hope for from tramadol.
There are over 1 million patients in MedStar, and we know when patients get older, they're on many medications. So we definitely have the patient population that could benefit from the measuring of pharmacogenetics. When you look at the studies in pharmacogenetics, and Mayo Clinic has done a lot of work in this area, they tested several genes that affect drugs, and they found over 90% of patients actually would have a drug-gene interaction. So clearly, when we have over 1 million patients in MedStar Health, most of the patients are likely to benefit from this test.